Neck pain. Why do people get neck pain? Well, the discs all degenerate and wear out as time goes on. We get more bent forward, it loads the discs more. For every disc you have in the front, you've got two facet joints in the back. They also can cause pain. They're moving parts. Look at all these moving parts you have in this short of an area. They can all degenerate, be a source of a pain. That's why so many people have neck pain. Also, muscle tension. If you sit slumped over like this, your head weighs more. Because of torque, it puts more stress on your spine. Every inch you are away from the center of axis rotation, it effectively weighs more. That stresses out the muscles. You got this big heavy weight you're carrying around all day, sitting slumped over. That causes neck pain. So neck pain, especially in a sitting job or doing a job like mine where you're operating like this, you've got to work at it. You've got to work at your body and your daily habits in order to not have neck pain. It's more surprising for you to not have pain than it is for you to have pain for all these sources. And almost everybody I know has neck pain at some point in their life, and it's a question of what you can do about it. Now, from a surgical perspective, if you get a degenerated disc, we can fix it. We go in through a pretty small, minimally invasive surgery, small incision, don't cut any muscle. We can take the disc out, put a piece of bone in there and a plate, screws and rods, and fuse it, which means we get rid of the painful disc, put some bone in there. The two bones will fuse together, the vertebra fuse together, the disc never moves again, it never hurts again. The downside is it's a surgery, and number two is if we fuse that one, it could put more stress on the ones above and below it, which can accelerate the normal wear and tear on those, and they may need to have surgery. So the fusion that's the downside. An artificial disc replacement is an option where we replace the painful disc with a mobile prosthesis that puts less stress on the other discs, but you've still got two facet joints in the back, which can still hurt, and you have nerves coming out, which may still get irritated. So they're both good surgical treatments, but they're both still the last resort. You want to avoid having surgery. How do you do that? Well, it's a combination of two things. One is relax the abnormal muscle tension that builds up. So the way we do that is you can get a massage to relax the muscles, cardiovascular exercise, get your heart rate up and break a sweat, washes out lactic acid, decreases stress in the muscles. You can meditate once a day for 15 minutes, take a break, lay in a comfortable spot, listen to some meditation hypnosis download and disappear for 15 minutes, decreases the tension that is built up throughout the day. And then the primary component is really muscle strengthening. Work on trunk stabilization exercises, put your base in a better position, and then work on chest out posture exercise. If you sit slumped like this, your head weighs more, stick your chest out, let your shoulders fall back, brings your head back over the rest of your body, decreases the effective weight of your head, relaxes the muscles, opens up the holes for the nerves. So chest out posture exercises. And our whole rehab exercise program is in our app, the Back Doctor app. But basically, pick up one or two exercises. I recommend the dead bug, where you lay on the ground and strengthen your core, and the standing dead bug, which you do up against a wall, just bringing your arms up and down, firing those muscles. I recommend you do those every day. You could do them for 2 minutes every day, and you'll be doing more than 95% of the humans in the world. Just do some exercise program throughout the day where you're firing the muscles, putting your body in a better position. So it's the combo of two things. Relax the abnormal muscle tension with meditation, diet, exercise, massage, and then reinforce better muscle firing by doing the exercise on a regular basis to put your head in a better position, strengthen the muscles to take the stress off the spine and to keep it on the muscles.